helpful clue for confluent growth is this. What's happening here is the epidermis looks like it's separating from the dermis. It's like a blister almost, like a little subepidermal cleft or separation. Looks almost like what we see in small blisters in inflammatory bullous dermatoses. So if you see a blister, again, I'm using air quotes here. If you see a blister, or what looks like a blister or a cleft, or like the epidermis is unzipping itself from the underlying dermis in the midst of a melanocytic lesion, that you have to think about melanoma until you can prove otherwise, because that's a worrisome sign. And what this is an artifact, and my understanding of why this probably happens is that there are so many melanocytes growing along here, pushing the keratinocytes out of the way, that when we process the tissue in formalin and the other chemicals we use to fix the tissue, there's sometimes some shrinkage of the tissue, and the epidermis normally is held tightly to the dermis by the hemidesmosomes and all of their adhesion molecules that hook onto the basement membrane. We don't have that here because most of the keratinocytes have been pushed out of the way by melanocytes. Melanocytes do not have those same adhesion molecules. They do not attach down to the basement membrane, and so the epidermis starts to cleft and lift away. So this is not like an actual blister in the patient. It's an artifact that we see microscopically, kind of like the clefting artifact that we see in basal cell carcinomas. It's an artifact, but it's a useful artifact because it's a clue to confluent growth, and it's a clue to melanoma in the context of a melanocytic lesion. Okay, so when you see that, now I've seen times where there's splits like this that are just due to tears in the tissue or something, so it's not that every time you see this cleft it's always melanoma, but you should really stop and think about melanoma when you see this sign right here, the unzipping sign or the melanocytic blistering sign. It's an artifact that's really useful, okay? So confluent growth, like I said, is often not nearly as dramatic as we see in this case of acromelanoma. But I think this is a good example of a really classic, really ideal example of confluence. And here's more of it over here with that same look again. That blistering artifact, or that unzipping sign where the epidermis and the dermis are starting to separate from one another because of overgrowth of the melanocytes.